times higher, while the average weekly rate of hospitalizations was 36 times higher in unvaccinated people than in fully vaccinated people. This week, we reached 85% coverage with at least one dose of COVID-19 vaccines and 78% fully vaccinated coverage for the eligible population 12 years or older in Canada. But with 7.3 million eligible Canadians not yet fully vaccinated with 2 doses and 4.8 million too young to get the vaccine, there are still far too many susceptible people and opportunities for the virus to spread. From the community level up and across all eligible age groups, every vaccination counts. Stopping one infection prevents a chain of transmission to potentially protect many other people. Likewise, your vaccination protects you and indirectly protects others who can't get vaccinated or who may not mount a strong immune response. This is why it is so important to take action quickly, increasing the overall rate of vaccinations and raising fully vaccinated coverage among young adults aged 18 to 39 years in particular could slow epidemic growth enough to reduce the risk of exceeding healthcare capacity through the winter. Rapidly achieving these gains could also reduce the need for more disruptive measures that may be needed to control activities if and when healthcare capacity is threatened. Today, Canada's National Advisory Committee on Immunization released updated advice regarding an additional or third dose of COVID-19 vaccine for moderately or severely immunocompromised people who are more likely to have had a less than adequate immune response to the initial 1 or 2 dose COVID-19 vaccine series. NACI continues to examine the need for booster doses, which, unlike additional doses, are intended to restore initially adequate immune protection that may have waned over time. Regardless of our vaccination status, we can all take steps to lower our risk while supporting and protecting others, including those at high risk. Continuing our well-practiced wash, mask, space habits, and finding safer ways to connect continue to be important COVID-19 prevention practices. Merci. Thank you, Miigwech.
Bonjour à toutes et à tous. Les résultats de l'épidémiologie nationale et de la modélisation présentés la semaine dernière montrent comment la résurgence du variant Delta pourrait évoluer au cours de l'automne et de l'hiver. Les vaccins contre la COVID-19 continuent d'offrir une protection substantielle contre les infections et les maladies graves. Cependant, maintenant que de nombreuses restrictions ont été assouplies et que les activités se déroulent à l'intérieur, nous pourrions voir les taux d'infection augmenter à des niveaux supérieurs à ceux que nous avons connus jusqu'à présent. En raison de la prédominance du variant Delta, plus grave et qui se propage rapidement, les taux d'hospitalisation risquent de dépasser les capacités hospitalières, à moins que nous montions rapidement la couverture vaccinale ou que nous ne mettions en œuvre d'autres mesures pour ralentir l'accélération continue. À l'échelle nationale, le nombre moyen de nouveaux cas signalés quotidiennement est désormais supérieur à 3 700. En moyenne, 1 600 personnes atteintes de la COVID-19 sont traitées dans nos hôpitaux chaque jour, donc 546 dans les unités de soins intensifs et en moyenne, 18 décès sont signalés chaque jour. Les cas signalés, les maladies graves et les décès surviennent principalement chez les personnes non vaccinées. De fin juillet à fin août, le taux hebdomadaire moyen de nouveaux cas de COVID-19 était 12 fois plus élevé et le taux hebdomadaire moyen d'hospitalisation était 36 fois plus élevé chez les personnes non vaccinées que chez les personnes entièrement vaccinées. Cette semaine, nous avons atteint une couverture de 85% de personnes ayant reçu au moins une dose d'un vaccin contre la COVID-19 et de 78% de couverture entièrement vaccinée pour une population admissible de 12 ans ou plus au Canada. Mais avec 7,3 millions de Canadiens admissibles qui n'ont pas encore reçu 2 doses de vaccin et 4,8 millions de personnes trop jeunes pour être vaccinées, il y a encore beaucoup trop de personnes susceptibles de contracter le virus et de le propager. Au niveau communautaire et dans tous les groupes d'âge admissibles, chaque vaccination compte. Chaque infection enrayée permet de briser une chaîne de transmission et de protéger éventuellement de nombreuses autres personnes. De même, votre vaccination vous protège et protège indirectement d'autres personnes qui ne peuvent pas se faire vacciner ou qui n'ont pas une forte réponse immunitaire. C'est pourquoi il est si important d'agir rapidement. L'augmentation du taux global de vaccination et l'augmentation de la couverture vaccinale complète chez les jeunes adultes âgés de 18 à 39 ans en particulier pourrait ralentir suffisamment la croissance de l'épidémie pour réduire le risque de dépasser la capacité des soins de santé pendant l'hiver. La réalisation rapide de ces progrès pourrait également réduire le besoin de mesures plus perturbatrices qui pourraient être nécessaires pour contrôler l'activité si la capacité des soins de santé se trouvait menacée. Aujourd'hui, le Comité consultatif national de l'immunisation, ou CCNI, du Canada a publié des conseils mis à jour au sujet d'une dose supplémentaire ou d'une troisième dose de vaccin contre la COVID-19 pour les personnes modérément ou gravement immunodéprimées qui sont plus susceptibles d'avoir eu une réponse immunitaire moins que d'adéquate à leur série initiale d'une ou de 2 doses de vaccin contre la COVID-19. Le CCNI continue d'examiner la nécessité d'administrer des doses de rappel qui, contrairement aux doses supplémentaires, ont pour objet de rétablir une protection immunitaire initialement adéquate pouvant s'être affaiblie avec le temps. Quel que soit notre statut vaccinal, nous pouvons tous prendre des mesures pour réduire notre risque tout en soutenant et en protégeant les autres, y compris les personnes à haut risque. Maintenir nos bonnes habitudes de lavage des mains, de port de masque, de distanciation et trouver des moyens plus sûrs de communiquer restent des pratiques importantes de prévention contre la COVID-19. Merci. Thank you. Miigwech.
Merci.
Hello, it's Teresa Tammy. I just wanted to make one clarification. I had a missing number in my remarks, so I just wanted to clarify one statistic. That the average weekly rate of new COVID-19 cases in unvaccinated people was 12 times higher than that in the fully vaccinated. And I did say that essentially the average weekly rate of hospitalized cases in unvaccinated people was 36 times higher compared to the fully vaccinated people. So vaccines are very effective. But I just wanted to clarify that number because I think I said 18 when in fact it should be 12 times for the case differential. Thank you.
Thank you, Dr. Tam. Merci, Dr. New. Thank you. We will now open the phone line to questions. As usual, we have that you limit yourself to one question and only one follow-up. And we'll be taking questions in both official languages. Nous allons prendre les questions. Nous demandons de vous limiter à une question et une question de suivi. Et comme d'habitude, vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, commençons la période de questions. Over to you, operator.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Stephanie Taylor from the Canadian Press. Please go ahead.
Hi, thanks so much for the question. This question is for Dr. Tam. We continue to see the country's cases of COVID-19 among those who are still not vaccinated against COVID-19 increasing. And there is a lot of public debate as to the efficacy of vaccine mandates or vaccine passports. In your opinion, do vaccine mandates or vaccine passports have any kind of an impact on boosting vaccination rates? And if so, what kind of an impact?
Thank you for that question. And I think this is a space that we're watching carefully at the moment as provinces and other players institute these policies. We don't have, I think, good evaluation or statistics, except that provinces individually have said, I think, in the media that they saw an increase in uptake. For example, Ontario, I think, has indicated that they saw an uptick in vaccination of the first dose after they announced their policies. And some other areas, I think British Columbia, for example, Dr. Henry or others may have also indicated that a certain uptick in people making appointments after they announced their policies. So it is, I think, as a measure, as a one way of encouraging vaccine uptake, is something that we should place close attention to and study, and that also helps other jurisdictions should they want to make these kind of decisions. But I would maybe have you refer back to the provinces to get more accurate estimates. Thank you.
Follow-up question?
Yes, thank you. On NACI's recommendation, can you provide any more advice on perhaps the age groups or which of the kind of immunocompromised categories should be getting an additional dose of COVID-19 vaccine? This can cover quite a few individuals, from all the way from children to those who are seniors. So who really specifically should be at this point booking their third dose appointment to get an additional shot?
Thank you for that question, and it gives me an opportunity to provide a bit more information. And so thank you for that. The vaccine recommendations pertain to age groups for which the vaccine's already authorized, so the 12 years and up. There's no recommendations at this point pertaining to those younger than the age of 12. And for those who are moderately or severely immunocompromised, there is a list, which is, quite a long list. So obviously we encourage individuals, but also their health providers to look at the list that is indicated in the NACI statement. But just as a sort of example of the range there's a very broad group of individuals who may have either underlying health condition or a treatment that's rendered them more immunocompromised. So these include moderately or severely immunocompromised individuals. For example, those who are receiving active treatment for solid tumor or blood malignancies, so-called hematologic malignancies, the recipients of solid organ transplants who are taking immunosuppressive therapy. There's some other very technical kind of therapeutic measures, stem cell transplants, and so it goes on. Those who have an actually underlying genetic primary immunodeficiency, stage 3 or advanced untreated HIV infections, active treatments of a range of immunosuppressive therapies. So we would encourage everyone to sort of check out the list. Most of all, talk to your health provider and discuss your particular situation. So what the recommendation is and how that is derived is really looking at the fact that some of these individuals through studies have had a lower immune response to the initial 1 or 2 doses of COVID-19 vaccine compared to the general population. And that recent studies, and these are limited, but they're being gathered as we speak, show that some individuals in this group who didn't respond to or had a reduced immune response to the 2 dose of an mRNA vaccine can have an increased immune response after a 3rd dose. Not everyone even mount an increased response to the 3rd dose, but some do. And so this represents a added layer of increased immunity and in adding that additional dose of mRNA vaccine. And the recommendation is for that additional dose to be an authorized mRNA vaccine. those who can't take the mRNA vaccine because of reactions in the past, etc., there is an option, of course, to look at the viral vector vaccine, but that should only be considered when the other options are inaccessible or contraindicated, because there's actually no studies, there's lack of evidence on the use of an additional dose of viral vector vaccine. So I've just given you a little bit more detail, but I know it's a lot to digest, and so the information is on the website.
Thank you, Dr. Tam. Opérateur, prochaine question.
Thank you, merci. La prochaine question est de Jean-Philippe Hugues de Radio-Canada. La parole est à vous. On ne vous entend pas, Monsieur Hugues. Vous êtes sur un main libre. Est-ce que vous pourrez prendre l'appareil? So we'll take the next question. The next question is from Christine Barak from CBC News. Please go ahead.
Hi there. Thanks for taking my question. Dr. Tam, based on all the data you just described, obviously you're encouraging Canadians to get vaccinated. You mentioned you haven't seen the data on vaccine mandates and how well they work. Is there data indicating what does work? In your view, what could be done to get more Canadians vaccinated at this point?
Thank you for that question. So the age group that we're particularly, want to up the coverage on is the young adult age group. I think the 12 to 17-year-olds are getting up there, and there will be some school programs, for example, provided by provinces and territories to increase the uptake in that group. So if we want to focus on the 18 to 29, or indeed 18 to even 39-year age group, there's many different strategies that the provinces are and local public health are instituting. Some of which they have to tailor it to their communities. And so some of it is about trust building, and so getting local leaders, getting influencers, youth influencers, people who can get to social media, TikTok in particular. I was just talking to colleagues in the north who said TikTok is part of the strategy because they've heard that their youth is sort of into the TikTok messaging. And so I think is a range of tailored approaches, but really increasing access, so mobile clinics, making it easy for people to access it from workplaces, for example, making it easy to access it from educational institutes, as well as these other strategies to increase vaccine knowledge and these different vaccine confidence building approaches, and of course sharing information, answering questions. And but social media, I think, is still a very important aspect of the strategy itself. But it's going to be very, very varied. And what I'm interested in is an actual study, of course, of the full range of approaches. But the question prior to that, which is do locally implemented requirements for vaccines to access non-essential services, for example, work, that I think remains to be seen.
Yeah, it's Dr. New. Maybe I can just add to what Dr. Tam said. Certainly ourselves at the federal level, but also obviously all of our colleagues in the provinces and territories are looking at all of, as you say, the tools available in the toolbox. So in terms of encouraging everyone to get vaccinated, and I think we're focusing now, as we've mentioned, on the younger adults, 18 to 39, and maybe predominantly males. At least that's what we're hearing from some of our colleagues in the provinces and territories. And so to that point, we're engaging with community leaders and communities in which we know that this group are part of. For example, the gaming community. We're working closely with the gaming community, the leaders, people that let's say young male adults grew up with, maybe idolize in terms of what they do with their various activities, and hope get them on board in terms of getting vaccinated. And then, of course, I think the vaccine passports, we're seeing our early indications that they are working, that there's been an uptick in registrations to get vaccine doses after various provinces have announced their policies. Because, if you need a vaccine passport or proof of vaccination to get into a bar or restaurant, attend a sporting event, and so on, that might be sort of the trigger that gets others who have not been vaccinated up to now to go forward and get their vaccination. But you're right, as Dr. Tam says, all of these things that we need to actually also measure the impact and then see what the results are, and then hopefully then adjust as we go along if there are things that are pointed out that maybe we could improve on. Thank you.
Thank you, doctors. Follow-up question?
Dr. New, I just wanted to clarify. You mentioned, are we seeing the lowest rate of uptake among 18 to 39-year-old males? And just as my next question, with regards to 5 to 11-year-olds, we're hearing that Pfizer-BioNTech is set to request approval for children as young as 5. Do we have a sense of when that a vaccine for that age group could come online?
Okay, thank you for the question. With respect to the sort of the vaccines for younger folks, as we've said previously, clinical trials are ongoing, and the results, I think, from the various companies are expected to be completed sort of imminently into the fall. And then, of course, there's obviously the submission process approval by the various regulators. Obviously, we anticipate that the various companies that are making vaccines now would have a submission into Health Canada, the regulator, and they'll do their due diligence. So if everything goes well, I would say certainly it's later towards the end of this year. That's maybe being optimistic, but certainly we anticipate that something would be coming forward certainly for maybe next year. But hopefully, if everything goes well, maybe more towards the end of this calendar year. But it's still a wait and see on that front. With respect to the vaccine uptake, you're right. We're hearing anecdotally, maybe we don't have the full data in terms of the younger age group, in terms of the breakdown male versus female, but certainly we've heard from our colleagues in certain provinces that it tends to be mostly males. And if you look at the vaccine coverage rates, yes, overall for that group, I think it's for second doses, full sort of vaccination, it's less than 70%, and I think it's or 80%, and for I think even getting that first dose overall, it's less than 70%. So that's, I think, quite concerning if you compare it to the, let's say, other age groups. I think for the older age groups, it's well over 90% in terms of fully vaccinated. I think, to be honest, I think my personal view is that it may be that older individuals, having seen, obviously, what happened during the first, second, third waves with many of their their friends and so on, unfortunately, succumbing to COVID-19, but also because I think they've lived through a previous time when there were many diseases that, with the miracle of vaccines, they were able to, not get, sick from, polio and so on. So I think in some ways, unfortunately, some of the younger folks have never had to live with what we call vaccine preventable diseases. And to them, it's not real the way it was, I think, for some of the older folks. So hopefully, as they see even some of their friends and others, unfortunately, getting COVID-19, some are having longer term effects, long haulers and so on with long-term effects from COVID-19. People are realizing it's not an innocuous disease that, I'll get over it, I'll be fine. It's something to really pay attention to. And I think we can't stress enough how important it is for everyone in every age group who's eligible to get vaccinated. Thank you.
Thank you, Dr. Anu. Operator, next question. Prochaine question.
As a reminder, you may press star 1 if you have a question. De nouveau, vous pouvez appuyer sur étoile 1 si vous avez une question. There are no further questions at this time. Nous n'avons plus de questions pour le moment.
Merci beaucoup. C'est ce qui met fin à la conférence de presse pour aujourd'hui. That'll be all for today's press conference. Have a good day.
Thank you. Merci. The conference has now ended. La conférence est maintenant terminée. Please disconnect your lines at this time. Veuillez s'il vous plaît raccrocher votre ligne. Thank you for your participation. Merci à tous les participants qui se sont joints.